tell us what challenges your organization has faced when advocating for maternal mental health?
Okay, there are several, challenges that we do face, considering that we are entering a very new topic, though there is quite enough evidence, research, scientific research, that shows that, yes, there are common perinatal mental health issues that affect the mother during the maternity care or during the perinatal period. So you find out that if you enter into our primary healthcare facilities or hospitals or clinics, you hardly get a proper infrastructure where, which is very safe or which is very conducive for women then to share their common perinatal mental health. So that becomes a very huge challenge that we do face. Also, you find out that in terms of human capital, I think globally, it's where now they have created these allied health council practitioners, something like that, where, some of the healthcare practitioners that have nowhere to be found, being in the nurses council, in the medical, whatever they may fall. We do have we do not have mental health practitioners per se, which are specifically there for the mild, moderate, mild, moderate, and other common mental health problems that affect the mother during the perinatal period. So you find out there are for the only the tertiary services, which is meaning for the severe aspect of mental health issues that are there. Because we know we have got halfway homes, we've got psychiatric centers, where of course women they go if they have got a severe and a chronic, mental health case. But for this common, there's huge shortage of mental health care practitioners. So that becomes a huge challenge now. Even to say we want to do the screening, we want to do, want to do the screening, want to do the advocacy. Yes, we can do. But, is it making any sense now? If somebody goes to where he's supposed to get the service, there's no service. So those are some of the real challenges that we do face. That's why we say you find that most women now, they end up suffering silent in terms of these common perinatal mental health, because there's no one to talk to except the social support that they get from their families.
What are some immediate solutions that SPANs can adopt to address this gap that you identified?
So citing pre and postnatal services in 2016, we realized that, there was very little awareness in Africa about common perinatal mental health issues. However, if you look at the research, you find out most of the research that are being carried out to justify this problem of perinatal mental health, it focuses much on the African society. But if you look at awareness now, you find out there's very little awareness that has been carried out. So we become the first organizers of a conference, So we said we need to raise awareness through a conference. So we become the first international organizers for the conference of maternal mental health in Africa. So what we did, we was the first one in 2016, what was a success. We was the second one in 2021, it was a success. And we was the third one in last year, 2023, and it was a very huge success, if I can say. We had a huge interest across, the globe, where people they come. For sure, we joined the and the message was very clear. We definitely need this within the African society. Even if you look at our policies or documents around perinatal mental health, even our mental health act, it's very difficult to find common issues to do with perinatal mental health being included. So that way now for us to come together as Africans now to talk about this within a conference or in a conference, we find it very, very important, considering the situation that we have around this topic of perinatal mental health. So in 2019, we also realized that there is a huge shortage of human capital now to make sure that, they screen, they provide family therapy, they do referral, they also do the continued support of women and families who suffer from perinatal mental health. So we introduced the first world diploma, where we are currently training family therapists. These family therapists, they are within the Allied Health Council register, meaning to say it's a cadre that is going to be included within the organogram of mental health within the Ministry of Health and Child, because they are already within that register. So currently we trained around 500 students that are onto our register, and we managed to have 2 graduations. The first one is 24 students. The second one was having 104 students who are graduated as family therapists. So these students, they also go for attachments, their routine attachment after 3 months. They will attach them either at a primary healthcare facility, a clinic, or at a busy hospital where women, they come for their between both antenatal and routine postnatal care visits, so that they do the screening using the recently validated PHQ-9 screening tool. So from the feedback, I think these cadres surely they're doing very well in terms of screening, referral, and provide the ongoing supportive family therapy. Also, as Society for Pre and PostNatal Services, we are strategically positioned, considering that we have got a memorandum of understanding with the Ministry of Health and Child Care. We are being found within the premises at a primary healthcare facility, where we strengthen the already existing services for the Ministry of Health and Child Care. Because like the Ministry of Health and Child, they believe in prevention. They say prevention is better than cure, meaning to say we need to invest more in educating people so that they understand what is it, what mental health is it is about. So we spend much of our time educating the women, both come for their routine antenatal, postnatal, and even though some who come for their physical, checkups. We need them to understand what is mental health within our local language. Because we also realize that language matters when it comes to addressing mental health issues. Because there are certain expressions that are being used within the Zimbabwe country that are not being used in South Africa, that are not also being used in other different tribes, So we realize that we need to continuously educate so that people, they understand. So we also invest more in attending international conference to make sure that we also understand what is happening globally. And both other countries, like especially in the developed countries, they invested a lot in the promotion of perinatal mental health. So in a nutshell, that's what we've done so far to make sure that perinatal mental health got the recognition that it deserves.
Thank you, Linos. You've spoken quite a bit about the organizational barriers that Spans has found when advocating for mothers. And I was hoping that you could tell us more specifically about common symptoms that women face specifically during the postnatal periods.
Okay, I will try to put some in our local language. Yes, people, they talk of, it's very normal to have anxiety. Of course, there's depression, but if you come to Zimbabwe, you find out depression is being expressed in many ways. The expressions, they differ for sure in depending where we are, maybe from which community are you. Maybe if you're in the Shona community, they will say zvakapuresa, ndiri kurwadziwa padundundu, or zvakandiomera, trying to explain the aspect of depression. That's why I say some ways these are professional terms. But when you come now into the society, the way how people, language is very, very important, because the moment you say the other thing and somebody saying something, it means you may fail to understand each other. So that's why I'm saying depression in our context defined in many ways. So it's up to us now as professionals to then contextualize and understand if women are saying this, what exactly what they're saying. So you find out it helps now us to make sure that we know we have got this problem at hand. Because if ndakaomerwa, what does that mean? And ndakaremerwa, what does that mean to our to us as professionals? And how best we can help that person. Of course, if somebody said ndakaremerwa, it means mentally, not the physical aspect. So we need then to make sure that we put that intervention, we help that individual so that he understands. So yes, it's very normal. We've got a quite number of these anxiety, severe psychosis issues that are there. But remember, people, they heal holistically now. Meaning to say some of these mental health issues, they maybe be labeled or referred to the spiritual aspect, where people, they say, anopenga, maybe because of some spiritual issues that affect this person. So holistically, what it means is, yes, there's the physical aspect, there's also emotional, there's also some spiritual issues that also come into play in defining some of these common perinatal mental health issues.
Thank you, Linos. And I just wanted to clarify also the language that you mentioned. So if when a mother comes into a clinic and they're explaining, their feelings and symptoms, what language do they use? What's the common words that they would use?
Okay, mostly I would refer to the Shona, like the ndakaremerwa, ndakaomerwa, zvakapresa, handitika, handisi kunzwa zvakanaka. Or maybe, mental health issues, some they can even express in the physical. So you need to be very professional. Because somebody can come and say, musoro wangu uri kurwadza, handitika, meaning to say there are some pressures that this person is going through. Yes, on the BP, so you need to understand, the history. You need to take the history now to understand when is exactly, you started to experience this high blood pressure issue. So it's not always that people, they maybe express they express themselves socially. They can even express them in the physical way, even in the spiritual way. But maybe there are mental issues inside.
So, Linus, could you tell us what you think the essence of the mother is?
To be very honest, to be a mother, to me, it means there are a lot of responsibilities. Like in Zimbabwe, they say musha mukadzi, meaning to say, if you took for a home, obviously you're talking of a woman. So what it means is all the responsibilities, all the roles that are being supposed or are expected at home, we really need to see a mother. So to be a mother, imagine the reproductive health issues, childbearing, care, So it means the mother or the women has many duties and responsibilities. That's why I say traditionally, women, they were just seated, while these men, they go for hunting and gathering. They go hunting and gathering, they bring food at home. And women, were there just to celebrate what the men brings. So it's up to now, because of technology, we find out, or maybe because of globalization, or because of changes, what is happening across the world, where women are now also going to work. But naturally, looking at the responsibility and the roles that a woman has, in the previous years, you find out that women, they were just seated at home, making sure that home is safe for everyone. So for me, surely, if we talk of women, we are looking at a huge task, a responsibility that she carries.
How do you think a mother's mental health affects the well-being of their children?
Okay, what's very interesting, what is happening across the globe is, professionals, they agree that what the mother eats affect the child. So what it means is what affect the mother emotionally, mentally, it also affects the child. And I think there's now enough evidence, there's enough research, there's enough scientific research to justify that whatever, when a mother suffers emotionally, mentally during pregnancy, it also affects the child. What the mother, suffers during the environment, it also affects the child. So we have got the evidence for sure that shows that, whatever mother went through emotionally, environmentally, spiritually, it affects the child during the first environment within in the utero.
And could you share any examples where focusing on a mother's mental health has had positive outcomes?
Okay, like into our context, Antonio, they say prevention is better than cure. When this prevention is better than cure, what they mean is we need definitely to continuously educate people as they come to the primary health care services. We need to educate them about health issues. And if you go to the WHO definition, surely there's no health without mental health. So what it means, mental health is a health issue. So we don't want to talk about physical issues when women come for their routine or for their perinatal period. We need also to talk about mental health. That's why we say prevention is better. So if people they understand what are these mental health issues, why is mental health important? Because we talk of mental health, I think we don't talk about we are not talking about problems, but we are talking about a sound mental health. So that somebody then be able to contribute productively at home, social places, at work, everywhere, because we have got a sound mental health. So we believe in that also to say we need to invest more in education so that women, they also understand the importance of their sound mental health, as they carry out their day-to-day duties.